Hi, my name is Dr. Spillane. I'm an oncologist in San Luis Obispo, and I'm going to talk a little bit about COVID-19 and cancer. And I'm going to share my screen here. Hopefully this works. So a couple things here. This is starting. So I'm giving this talk on, let's see, it's January 25th. So this is updated as of today. And so things are changing on a daily basis, and we get a lot of information about COVID-19, and it gets very confusing. And I think one of the key important points to remember is that with all the misinformation out there, you have to have a reliable place to go for information. And so probably the most reliable place is going to be the Centers for Disease Control. And on the slide here, I have the access to their website, but it's basically www.cdc.gov. For our local information of what's happening in our county, you can go to the San Luis Obispo County Health Department. And again, there is on the screen the website, which is emergencyslow.org. And as far as new information that comes out, when stuff gets published, and if it's something important with regard to a vaccine or new treatments, generally they're going to get published in a respected, peer-reviewed medical journal. And the main journal that these things are getting published in is called the New England Journal of Medicine. And so some things that get published in the New England Journal of Medicine are generally reputable and peer-reviewed. So that's where you should be getting information. Also, obviously, talk to your doctor. And just kind of an update as of currently where we are this week. There's 25 million cases in the United States, over 400,000 deaths. I think most people already know this. So what about COVID-19 and cancer? So COVID-19 patients with cancer, they have higher risks in all severe outcomes. Patients with hematologic cancers, which are blood disorders like leukemia and lymphoma, as well as patients with lung cancer or metastatic cancer, which means the cancer has spread and is throughout the body, which we call stage 4 cancer. Those ones had the highest frequency of severe events. And there's an increased risk of severe complications in cancer patients. There's also an increased risk of COVID-19 mortality in cancer patients. And you know, one of the things that's come out pretty clearly recently is that a person who is immunocompromised, they can continue to shed virus for a longer period of time than somebody who's not immunocompromised, and it could be as long as 30 days or more. So usually the quarantine periods are 14 days, but for immunocompromised people, that may need to be longer, up to 30 days. And aside from cancer, what are the other risk factors? And again, I think most people read about this or hear about all those other risk factors, but things like diabetes, smoking, obesity, heart conditions, heart failure, people have coronary artery disease, COPD, which is lung disease, people with Down syndrome, kidney disease, and cancer's on the list. This was a study out of the United Kingdom that people with solid tumors, so for example, other solid tumors, I think these would include things like breast cancer, colon cancer, they really had the same response to COVID-19 as those without cancer. And it seemed like the patients with blood cancer varied in their ability to respond to the virus. And some of them, again, had trouble getting rid of the virus for even up to 90 days. So they considered that to be about 5 times longer than average. During all of this COVID-19 pandemic, we've all had to make adjustments, and we're always sort of looking at the pros and cons of everything we do in medicine, but especially in cancer care. And so when we're making decisions, we're really trying to balance the risk related to the cancer versus the risk related to the virus. And in some situations, the risk of the cancer is greater than anything that the virus could offer. And so we need to push onwards in terms of treating a patient's cancer. Some of the things that we've realized are happening is that a number of things are getting delayed or postponed. And these could be even things like screening tests, like mammograms, colonoscopies. I mentioned in here the FIT, which stands for fecal immunochemical test, which is a way you can screen for colon cancer by simply getting a kit. And you can order them online or get them from your from your pharmacy, and then you mail the kit in and get the answer back. And so one of the questions everybody's asking is, will this delay in screening have an impact? Will there be a surge of cancers because people weren't going in for their screening as would normally be done outside of a pandemic? And then other things that we're considering all the time are, for example, if, again, balancing the risk benefit, we're trying to decide whether treatments could be delayed. I mean, what kind of cancer treatments could be delayed? Is it something that's not necessary or not urgent? And so we are occasionally delaying things because of this pandemic. And we haven't really faced this here locally, but again, if hospitals get impacted, we are going to be putting off elective surgeries and or surgeries that can be put off. And so that is going to have an impact, obviously, on cancer patients as well. We've had, for example, when we were back in March, we had situations where hospitals were putting off elective surgeries, and a lot of breast cancer surgeries got put off. And so we had to make decisions, for example, where we would start patients on treatment, systemic treatment, and start shrinking cancer before their surgery was ever done. One of the things that we're focused on in our practice is really keeping the clinic safe. So all healthcare personnel in our office get screened daily, and if anybody's sick, they stay home. We all have access to PPE, and we have a system where there's extensive cleaning of really every space in the office and in the exam rooms between patients. We focus on hand washing, soap and water scrub for at least 20 seconds. We triage the people coming in, and that's not just patients, but families. And so we really try to make an effort to make sure that if somebody is coming into the clinic, that they need to be there. If somebody's really sick, they may need to be in the hospital. So we might want to keep those patients out of our clinic. And family members, we're really trying to have them not come in if they don't need to be coming in, especially anybody who's sick. We've had situations where we'll have people wait in their cars and try to keep people out of the waiting rooms. And then we'd call them and say, okay, it's your turn to come in. And so then they would come in. So those types of simple ways of trying to mitigate against the virus by keeping our clinic safe. Occasionally, we'll just reschedule patients if need be. And then everybody in our clinic, not only the staff, but all of the patients that come in are wearing masks, and we're practicing social distancing, especially in our infusion center where we're trying to keep people safely distanced during their infusions. We are using lots of hand sanitizer, obviously. We've set up a triage station outside the clinic, so out in the open air where a medical assistant can greet patients and do a triage to find out who should be let in, and if there's any risk factors that come up, we would have them delay, or even sometimes we'll have some management in the parking lot or taking care of patients outside. If somebody is positive, so for example, if one of our patients are positive, generally we're recommending that we would delay treatment for 10 days and really make sure that they're better and over the COVID before we would resume treatment. One of the things that's come up with all this is something called telemedicine. And I think those patients who are being seen on a regular basis, they realize that doctors are now allowed to do telemedicine, which means that we can visibly visit with the patient and do a regular visit either. And there's a lot of different ways of doing this. We tend to use a lot of FaceTime, which is on iPhones, and we tend to use Zoom for people who have a computer. Unfortunately, though, there's a lot of people that just can't afford either a cell phone that has FaceTime or some other visualization app. And some people just don't even have a computer, or they don't know how to use a computer. And often we will have patients' family members help. So it's maybe a son or a daughter that comes over and helps set up their telehealth visit. And therefore, it's important that if you are going to do a telehealth visit, that you really kind of need to familiarize yourself with the technology, or have somebody in your family or a friend or a neighbor get involved that can help you out. And then with these telehealth visits, it's a good opportunity to be prepared, write stuff down, like all the medications you're on, what kind of questions you're going to have. So that way it's it's not only an informative, but very efficient way of meeting with your doctor and taking care of anything that needs to be taken care of. Patients undergoing treatment, if they are COVID positive, like I said previously, we're going to delay their treatment for 10 days. If they're sick, probably need to go to the emergency room. If they're not that sick, then probably staying home and taking care of yourself at home and quarantining is probably the right thing. Some of the things that we're looking at, in other words, how can we, again, decrease exposure for patients that are undergoing treatment? And we've kind of looked at things such as if there's an equivalent form of a medication that can be taken by mouth instead of intravenously, we might switch to that and then have them stay at home so that they don't have to come into the clinic. And there's other treatments where we can switch the treatment around so that the IV infusion can be much shorter. So instead of 4 hours, maybe we should just do it over 30 minutes and try to decrease the exposure time that a patient might have in the clinic. And there's also medications where we can choose to give it as a subcutaneous injection or sometimes an intramuscular injection rather than intravenously. And maybe those are better treatment options, again, to decrease exposure risk. We've also set up some home infusions. Often we can have a patient get hydrated at home through home health and avoid them having to go to the emergency room or come into our clinic. Other things that are impacting us are really the fact that if our employees are sick, they stay home. And if we are worried about COVID, they're going to be home for 14 days. So we are having a lot of staff shortages as well as other hospitals that are having the same problem, and I think other clinics. And the other interesting thing is that we're seeing a shortage of some drugs. There are certain companies where their factories may be shut down or they have staff problems and they can't get the pharmaceutical drugs out to us in an efficient way. And so there are some medications now that are not available, and we have to switch to other equivalent medications. So that may be something that if you're undergoing treatment, you're finding things are getting changed around a little bit. The other thing that has affected our patients is the ability to go out and see some of the ancillary service people, not just dentists and things like that, but we used to have people go to our resource centers, the ones up in Templeton, as well as the ones at San Luis Obispo, and even down in Arroyo Grande, and also down at Mission Hope in Santa Maria. And so not being able to go in there has really had an impact. We've tried to do as much as possible of having any type of virtual meeting or discussion with an ancillary service. We try to make those available. So these would be things like support groups, but also maybe talking to the nurse navigator. And I think there's even the ability to have speech therapy and physical therapy in a virtual session as well. So what are some of the simple things you can do? If you're a cancer patient, what can you do? Well, getting a flu vaccine is probably one of the most important things you could do. You don't want to get flu and COVID, that would be bad. So getting your flu shot, we still recommend. And then some of the basic things that you hear over and over, but wear a mask, especially out in public or around others. Make sure you continue healthy hygiene, hand washing, practice social distancing, stay at home as much as possible. Ideally, somebody else in your family should be going out doing the shopping. Stay away from people at least 6 feet. Don't touch your eyes, nose, mouth. Make sure you have access to several weeks of medications and supplies in case you need to stay home for a prolonged period of time. Avoid crowded places. Those are all pretty obvious. What about the vaccine? I know this question comes up almost daily. And currently now it's being offered to healthcare providers and people 75 and over. But there are two vaccines, as most people know, Pfizer and Moderna. Both vaccines have been shown to be safe and effective. And at this point, there's no evidence that they would not be safe for most cancer patients. The clinical trials did not have cancer patients in them, so it doesn't really answer the question. But again, there's no reason to think it wouldn't be safe for our cancer patients. Some other points on the COVID vaccine. Immunocompromised individuals have the potential for a reduced immune response. And so they need to continue to follow all the current guidelines as well as everybody else, but also just continue the social distancing, hand washing, etc. And while some immunocompromised patients may experience a decreased response to the vaccine, it still may confer some benefit. And so we still think that it is reasonable and worthwhile for patients to get vaccinated, even if their immune system is decreased. We would try to optimize that, though. For example, if a patient were undergoing chemotherapy every 4 weeks and we knew that their immune system was going to be at its low point at 2 weeks, we'd probably want to wait till their immune system had recovered right before the next cycle of chemotherapy before they get the vaccine. And at this point, the panels and experts that are involved in this, they say that providing the vaccine to patients and the caregivers should reduce the risk. And so we think that that's something important. And if you have the opportunity to get the vaccine, you should take advantage of that. Oh, 1 second here. I'll call you back in a second. Sorry about that. So if you get COVID, call your doctor. I mean, that's the first thing you want to do, and just let them know. For most patients, and that's probably at least 80% or so, it's mild to moderate symptoms. And the severe symptoms where you start getting dyspnea and shortness of breath, that's maybe 10 to 14% of patients. Critical patients, that's 5% or less. Again, with some discussion with your doctor and your symptoms, you'll have to make that decision about when it's important to go into the emergency room. And obviously the emergency room physicians would make the decision about whether it needed to be admitted to the hospital. It's also important to know that we currently have a, there's a registry that is developing for cancer patients. So ask your doctor or your oncologist if you are a cancer patient and you get COVID, let them know, because that, if you're willing to do it, it'll become part of a trial, really a nationwide trial, looking at outcomes in cancer patients, which I think is very important. So anyways, if you're listening to this and you have cancer and you're right in the middle of this unprecedented pandemic, I mean, I thought, gosh, you know, how terrible would that be that you get diagnosed with cancer and at the same time you're told, you know, you can't visit with your relatives and friends and family. And I think that all really adds up to a lot of stress, loneliness, and helplessness. I mean, my thought on this is that that would just be a normal reaction that anybody would have in a very abnormal situation. And so I would expect people would have anxiety, depression, insomnia, and all these things. You know, reach out to people. There's people out there that can help you. Start with your medical team, but don't be afraid to ask for help if you need it. That is the end of my talk. And if you want to talk to me or anybody in my office, please reach out through the clinic, and you can also reach out through our resource center. And I appreciate your listening to me. Thank you.